Here's the truth. You do the work, you care for patients, you fight through schedules, documentation, and the chaos of healthcare. So why shouldn't you get paid on time? That's where Athelis RCM comes in. It's billing, but smarter, AI-powered, fully automated, and it integrates with your existing EMR. It handles everything from claims to denials and revenue reports. It's like hiring an entire billing department without hiring an entire billing department. And providers are raving about how much time they get back. Not to mention 15 to 20% boost in collections, not too shabby. So yeah, you can have fewer headaches and more money. Just book a demo at athelis.com. That's ATHELAS.com and see what your billing could look like when AI has your back.
We spend $50 billion a year on falls. It'll be $100 billion by the end of the decade, the way the slope of the curve is going. We can save some of that money because if we prevent some of these falls from happening, that ambulance ride, that ER visit, that hip replacement surgery, all those expenses start to dissipate, and you spend less money on that, all in exchange for a $140 PT or OT fall risk assessment, right? So in the country right now, with the current rates, this assessment we're talking about would cost about $140. We want to make that free to the patient. But one injury from a fall that results in medical costs is $10,000.
Physical therapy doesn't just happen in clinics. It's shaped by policies made in Washington. And right now, those policies are putting both patients and providers at risk. Nick Patel is leading the charge for change as Executive Director for the Alliance for Physical Therapy Quality Innovation and National Director of Clinical Services and Regulatory Affairs at U.S. Physical Therapy. He's working to stop Medicare cuts, expand access to care, and push for laws like the SAFE Act, a bill designed to prevent falls and reduce opioid use amongst older adults. Today, we'll break down what's happening in Congress, why it matters to every PT, and how you can take action to protect your profession. Let's dive in with Nick on PT Pintcast. Nick, welcome back to the show.
Thanks for having me, Jimmy. Good to be here.
I feel like every time you come, it's like, something's going on, and I need you to pay attention, and I need you to do something. And that can't be easy, right? Like, you're constantly listening to the profession, paying attention to what's going on in DC. I mean, just before we hit record, you said, hey man, just got off a plane for DC. And then next week I'm going back to DC. And that's where decisions are fortunately or unfortunately made. Like it or not, that's where things happen. So I feel like you're the guy who's always like, hey everybody, I need you to pay attention to this. And then in a few weeks, it's this other thing. Things are always happening. That can't be easy for you.
Easy? No, because no one can stay on top of what's going on in DC. So sure. I don't think it would be easy for anybody. However, is it needed? Yeah. And is it something that, we as professionals need to do a better job at it, right? Things happen all the time that affect us as therapists or as healthcare providers from decisions that are made in Washington and other state houses around the country, and not being on top of those things sometimes can hurt you. And so it's on all of us to say, hey, look at what's going on here. Hey, just found out this is going on, and bring that out to the masses. And one of the beautiful things is though that we got people like you who've got great reach, and we can get on do a podcast. We've got companies who are just killing on social media right now, so we can get the message out much better. So we're learning and we're doing much better at it.
All right. So of importance right now, we'll start off with the big stuff, the SAFE Act. That's HR 1171. And now that bill aims to prevent falls and reduce opioid use amongst older adults. So far, Nick, I'm all in. I like both of those things. I'd like both of those things to go away. Why is it such a game changer, and what can physical therapists do, the people listening right now, to help push this thing forward?
Well, the reason it's a game changer is it positions therapists as really the experts in fall prevention, because I mean, that's what we are. And I think I've talked to you about this before, but I wish you could change your name to fallologist, right? Because then everyone would know what we do, and everyone would know like that's us. But the reason why it's important right now is because, there's this stuff going on that you guys may have heard of, which is called a reconciliation bill. And the president wants to have this really huge bill that comes out that says a lot of things. They're trying to put extension of the tax brackets in there. That's a huge thing in and of itself. But They're trying to put Medicaid reform in there. There's going to be healthcare provisions. There's going to be provisions for things that extend way beyond taxes. We have a commitment that they're also going to try to address fee schedule inside reconciliation. But the problem is all this stuff costs money. And where the SAFE Act can be positioned, and what I just basically spent the last few days in DC doing with some of our other APTQI board members was saying, hey, look, we understand you have to pay for a lot of this stuff that's coming out. And here's an idea. We spend $50 billion a year on falls. It'll be $100 billion by the end of the decade at the way the slope of the curve is going. We can save some of that money because if we prevent some of these falls from happening, that ambulance ride, that ER visit, that hip replacement surgery, all those expenses start to dissipate, and you spend less money on that, all in exchange for a $140 PT or OT fall risk assessment, right? So in the country right now, with the current rates, this assessment we're talking about would cost about $140. We want to make that free to the patient. But one injury from a fall that results in medical costs is $10,000. So the premise is pretty simple. If a PT as whole can bat better than 1 for 70, this bill starts to save us money. Right. And we know that we are better than 1 for 70. Yeah. So we're positioning this as a solution. So when we go to Congress, we're not saying pay us more, and get in line with everybody else who wants more money. We're saying, here's something that you can use as an offset to save money. It's better for patients. One of the things we're really excited about is, it's easy to position this as it's good for therapists, but we're not going to have a windfall from this, but it's really great for patients. And it's not just us saying, so we got a public statement of support from AARP saying that they support this bill. So it really is better for the patient. And oh, by the way, it happens to be helpful for what, Congress is trying to do right now with the reconciliation bill. So that's why it's important. What can folks do? We've been talking about it constantly, contacting your members of Congress saying, here's the bill number 1171, please support it. Get your patients on board. You as a therapist, you're one person, but you treat dozens of people a day, multiple dozens a week. I'm sure all of them either are at risk for falling themselves or have a loved one that is. Your father, your mother, your grandparents, your in-laws. This affects everybody. So start getting other people involved. You'll be surprised how easy it is to get some folks, relating to this, because everyone probably knows somebody who is at risk or has already fallen, and that fall has completely changed somebody's life.
Yeah. And with baseball season just a couple hours away, 1 for 70 is 0.0142. I think we can bat better than 0.0.
I'm pretty sure. I have faith. I have faith.
So that is the way, like it or not, but contacting the people that represent you is the way to make change. Right. Now, a little bit of a different organization, or maybe some crossover. Medicare cuts in the future of PT. Ongoing reductions in Medicare reimbursement rates have been a huge concern for the profession. Just go into any Facebook group and you hear that left and right, people complaining about that. Can you break down the latest developments and what they mean for PT clinics and, of course, ultimately their patients?
Yeah, where we are right now, it's a pretty precarious state. People are talking about it's a 2.8% cut for this year, but that's just looking at it too narrow. In the last 5 years, we're talking about 5 consecutive years of cuts. This is like 11% cumulatively, and we've did nothing wrong. This is not in response to a punishment. This is that therapists are doing bad things. You hear these terms flung around: fraud, waste. We're not part of the abuse or the fraud, that's not us. But we're still getting this huge cut. So where things currently stand as it comes to Medicare reimbursement is, I was alluding to it earlier, we're trying to make sure that it's addressed in this huge bill that they're trying to put together on the tax cuts. And we received some commitments that they are trying their best to put it in there. However, again, it's not done until it's done, and it could still take a while. I don't think anything's imminent. This bill they're trying to put together will likely drag on into the summer. And one of the messages that we took to the Hill this week was, hey, if you are able to come together to give us a little bit of a reprieve on the fee schedule for a short-term fix and a patch like they've done in the past, if it happens near the end of the year, shouldn't we just look at maybe making it for all of 2026 too? Because why should we come right back in December and say, hey, we have a problem? And again, so we're getting that word out that we understand these things take time, but then maybe the trade-off is we didn't get relief in the first half of 2025 to maybe try to take care of 2026 while we're at it and just give us some more breathing room. Long term, I think we got to start looking at things like, how do we protect ourselves from cuts in the future? Because we can't keep getting on this merry-go-round of, we got cut bad. Now let's try to get cut a little bit less and get a little bit money back. But at the end of the day, again, you look backwards and we're down double digits in a short amount of time. It's not sustainable. It's not fair to our therapists over the long term. Who's going to want to become a therapist at that rate and go to school for the length of time you have to go to school when you could do any number of other healthcare professions that are great professions and that help a lot of people. But the risk reward's a lot better for your degree, right?
Sure.
The cost to get your degree. So we have a problem here, and we need to start thinking long term about where do we go from here in terms of how do we solidify the value of therapy in the eyes of the folks who make these decisions, to say we should start protecting this service instead of looking for ways to cut it, especially when it's not much left. There's not much meat left in our bone, unfortunately.
Yeah. All right, real talk for a second. If you're a physical therapist or running a clinic, you already wear like 50 hats a day. Clinician, manager, scheduler, part-time tech support. I see you. But what if you had a sidekick that could help you do all of that? Something smarter. That's where Empower EMR by MW Therapy comes in. It's built just for physical therapists, and it's loaded with smart automations and AI that help you grow your practice without burning out. No more chasing paper trails or fighting outdated systems. This thing handles billing, scheduling, documentation, patient engagement, all in one clean, customizable platform. The best part? It's actually affordable and scales as you grow. Clinics everywhere are loving it, and if you're ready to take the stress off your plate and be the hero of your practice again, check out a free demo at mwtherapy.com. Yeah, I think you're right. Let's go to a different bill, Medicare Patient Access and Practice Stabilization Act. For those keeping score at home, that's HR 879. Now, that bill has major implications for both practitioners and patients. What are the key points PT should understand, and how can they help push it through?
Yeah, this is a really important bill because it's highlighting the fact that, like I said, we've had these cuts at a time when inflation is run rampant and everyone's costs. If you run a clinic, you're paying more for your rent. You're paying more for your supplies. You want to be a good employer. You're trying to give everyone as big a raise as possible for your wages. You can't run a business where your expense line is going straight up and your income line is going straight down, and that's what's happening. So what 879 is trying to bring to the masses is, look, for beyond the fact that we keep getting cut, we need to start incorporating inflation into the equation here, because it has not occurred. And unfortunately, in the office space setting, so it's not just therapists, but anyone paid on that fee schedule, which is a lot of physicians as well, our schedule has been frozen from any kind of inflationary update at all. So again, same thing. You have the bill number. We need to get folks to understand that our fee schedule is not keeping up with inflation. And again, for the long term, we have to at least start getting to where every year it's a given that providers' expenses are going up, and that payment should go up to at least try to offset some of that.
Yeah. And we'll reiterate, many PTs feel sometimes like policy is someone else's job. It's not just the job of big organizations or people whose job it is to go to the Hill. It's crucial for every clinician to get involved. When representatives can hear these messages from multiple voices in their communities, from patients that may or may not vote to get them back into office, they tend to pay attention, and it is an effective way that they can make an impact. If I asked you to look into a crystal ball, if PTs and OTs don't take action now, where might you see our profession or our professions in 5 years? I mean, I don't want to rattle the saber and fearmonger, but you do want to make sure people understand the tension in the story or the things that might happen. What's at stake if some of these legislative efforts don't succeed?
Well, here's what we're looking at, I appreciate your point about let's not get too morose, but let's look at what the trends currently are. I mentioned this a little bit earlier. Who wants to go to PT school in 5 years if the situation is that you continuously get cut? And oh, by the way, in 5 years, if anyone thinks that tuition will go down, I'd love to talk to you. I don't know how you would get that. So whatever the cost is today, every year from now in the next 5 years, the cost to become a PT will go up. Also, every year of the next 5 years, the salaries to be a PT may not be moving much. And as those widen, we're going to have a workforce problem. And the APTA published a nice a paper kind of highlighting that, hey, we're starting to see projecting shortages. And I think that will only exacerbate, actually, because we have a pipeline that we're used to getting new grads every year to, replace people who retire or cut back on their hours. But what happens when your pipeline dries up? And also from separate from the workforce, let's just talk about access. Our members are closing clinics that have 20 patients a day coming in. We're not closing clinics because we have no one coming in and there's no demand for our services. In our country, there is absolutely a chunk of baby boomers coming into Medicare every single day, and they will guzzle PT resources if they can and services if they can. However, if the payment we get for those services can't meet our costs, we're going to have to shut down clinics. So when you have a service that people want and will come in and you have the volume, but you actually have to close the clinic anyway, what's going to happen to your patients who need those low cost services? They're going to fall more. They're going to have more surgeries than they probably needed. They're going to be less independent. Maybe they're living with their kids more. Maybe they're living with in nursing homes. I mean, think about this. If every household, there's not enough Generation X folks to tell the boomers, you can come live with me. Right. And when someone does, if they're in that situation where they can do that, someone's got to stay at home with them. Now you're taking people out of the workforce. There's a whole add-on effect. And I know I'm maybe drawing some lines that you think, okay, that might be a stretch, but it's not. When we're talking about not having an independent, healthy senior population, these things happen. And if you talk to anyone with an older person in their home, or they're a caretaker for someone elderly, they are probably shaking their heads and know exactly what I'm talking about.
Yeah. Yeah. When access goes down, when reimbursement goes down, that is going to close clinics and that's going to reduce access, and then quality of life. I mean, we want to start with finish with the end, which is quality of life will go down for those who need it the most. Some people, I ran into like some bigwigs this last weekend. I was away at a conference. Some people actually, like bigwigs, people who run companies, listen to this show. And
wow, amazing.
Who knew? APTQI is an organization that brings together organizations to do a lot of the work that Nick is talking about. So Nick, I'll give you, since we know sometimes big fancy people listen to this as well. What's your pitch for organizations who are not members of APTQI of why they should join? What would they get out of it? What would our profession get out of it?
Sure. So if you're a leader of a company that, and it doesn't even have to be a company that is a provider of care. If you're a leader of a company that has any stake in the profession, maybe you sell equipment to therapists, maybe you sell software to therapists, maybe you sell a platform or you have a digital platform, whatever it happens to be. If as therapy goes, your company goes, there's a place for you at APTQI. And what I mean by that is we have a structure to where we have membership. If you're a provider group, we have a structure. If you're we have a membership tier if you're sort of like a vendor for therapy providers. And what we do with our members is, one, we educate them on what's going on. But two, we take all of them to DC and we have them talk directly to lawmakers and say, this is what's going on. So you were mentioning, I just got back from DC yesterday. I was there with about 7 of our CEOs, and I'm going back next week. The plan is about, another 5 or 6 of our companies are sending representatives to, and we'll take you on a hill. What we do with your dues money is we get materials, we get, lobbyists that help push our cause, and we take you on the hill and we say, this is what we need to do. And this is who we need to talk to. And this is what we need to say. And it doesn't matter if you've never done it before. We will show you what to do.
APTQI.com is where you can find out more information. Always informative. Thanks for keeping us abreast of a situation. Would love to hear more. Maybe we'll bring you back in a couple of months to hear where these things that we talked about now, how they played out. Update. And then I know this is going to be a shock to the audience. I bet there'll be something new we need to pay attention to, because that's just sort of how this works. Good job. Good job, security, for you. But that just highlights that there's always stuff going on that we need to pay attention to, and we have to stay vigilant or we don't get represented.
That's it in a nutshell.
Let's be real. You didn't become a therapist to be average. You've got something in you that wants more mastery, more impact, more confidence in the clinic. That's exactly what Brooks Institute of Higher Learning delivers. Their residency and fellowship programs aren't just resume builders. They're transformation zones. You get one-on-one mentoring, deep dive classwork, labs, and real-time experience inside one of the most advanced rehab systems in the country. And the best part? You're not grinding this out on the side. You get a full salary and benefits while you train with the best. Whether it's ortho, neuro, peds, geriatrics, women's health, Brooks IHL helps you become the expert you know you're meant to be. Check out brooksihl.org to learn more and take that next step.